for a moment, and this might not be that hard to imagine given what's going on in today's world, but that you wake up in the morning and all of a sudden you realize that something's not quite right. You start realizing you're sniffing and you're coughing and your throat's sore, and you think, well, I'm shivering and I'm freezing and now I'm hot and I'm cold, and you realize something is not right here. And so what do? Well, typically you would get up, call your doctor, make an appointment, climb into your car, drive over to the doctor. Maybe you're shivering the whole time. You get into the office, you wait in the waiting room around other people. You finally get into your doctor's office, your doctor talks to you, takes your history, and then you're told, well, you know what, I think you have an infection and you need some antibiotics. And so your doctor gives you a prescription, off you go, bundled up, climbing into your car, driving off to the pharmacy, and there you get, well, maybe after waiting a few minutes, you get your prescription, you get back in your car, you go home. It's a big ordeal. But what if you didn't have to do that? What if you could get personalized healthcare in your home without ever leaving? Well, that's what we're going to talk about today. My name's Teri Fisher. I'm a physician and clinical assistant professor at the University of British Columbia in Vancouver, Canada. And I'm a huge voice enthusiast. In fact, for the last couple of years, I've been running a podcast, Voice First Health, and running webinars all about how voice is going to transform the way that we experience the whole healthcare journey. And today I want to talk to you about how voice is going to become, and already is becoming, the operating system of personalized healthcare. And so to start off, I want to play you a short little video clip, and this is from the movie Elysium. You may have seen it. It's a sci-fi movie. I love sci-fi movies. It's where the Earth has gone to you-know-what, and a society has formed on a space station where everything is just perfect. And a mother has managed to bring her child from Earth to this society where her daughter needs healthcare. And so this is a little clip of this mother bringing her daughter into one of these sick bays in a person's home. Let's have a look. Pretty remarkable, huh? So, 2 questions for you. First of all, if anybody knows where I can get one of those for my hospital, I'd love you to get in touch with me. And number 2, what you're experiencing there, what you saw there, is a sick bay in a person's home. It's not in a hospital. It's not in a clinic. It's a home. And what I imagine, my vision of the future, is that we are going to be able to get our health care in our home, and voice is the primitive part of what we just saw. So let's go on. I'd love to chat with you a little bit more about some of my ideas. Okay, so I want to start with another short story. And I can remember when I was about 10 years old, I came home one day from school and my parents had this new technology and they said, "Hey, we've got this new technology. We want you to check it out." I was so excited. I ran into the office and there sitting on the desk was a big boxy thing that looked something like this. It was a Tandy Computer from Radio Shack. And you remember what that was like? Some of you may remember. We put in those 5 1/4 inch floppy disks into the drive that you see there. We closed the drive, we turned on the computer, and we sat there and we waited while MS-DOS loaded. And I was so into it. I sat there and I typed for hours on that keyboard. I don't know what I typed, but I typed something for hours. And it was a lot of fun. And then technology evolved, of course, and we got to something like this, where now you can see a mouse, and you can see that we've got a graphical user interface, Microsoft Windows, and now we could click and drag and drop things. Really magical. And then, of course, just over a decade ago, Steve Jobs stood up on stage and introduced the iPhone to the world. And now we had a powerful computer in the palm of our hand that we could just tap and type and swipe and zoom and pinch and all those great gestures that we all know how to do, so commonplace now. But what's the same about these? Well, In the case of the first example, we had a keyboard. That was a physical device, something that we used to communicate with the computer. In the second case, we had a mouse. Again, a little bit more intuitive now because you can drag it around and you can just simply click on the things that you want to click on. But yet, it's still a physical device that we're using to interface with the computer. And then in the third case, we had, of course, the touch screen. And the touch screen, again, is more intuitive. Now we just point to it with our finger. But it's still a physical device. In other words, we have had to adapt the way that we communicate with a computer through these devices in order for the computer to understand what we are saying. But things are different now. Now, for the very first time in our history, computers are adapting to us. Due to artificial intelligence, natural language processing, natural language understanding, we can now simply use our voices. And why is that so important? Well, this is a completely new paradigm. And when we think about different types of communication, you can break it down into approximately 4 different types that are very common. Number 1, nonverbal. If you look at this picture, you can ask yourself, what emotion is this person displaying? And maybe you say happiness, excitement, triumphant, those sorts of positive words. And the key thing is that there's no communication of words here. This is all just by looking at a picture. What sense are you using to do that? You're using sight. What about written communication? When you look at this picture, this is clearly displaying a message. We can read it. This is the sign you've been looking for. And this is a very clear form of communication. But again, what sense are you using to interpret this? Again, you're using sight. And for those people that don't have the sense of sight, there's other ways around this, of course. Like think of Braille, for example. That's still a type of written communication. Visual communication. So this is signs, emblems, symbols. And if you look at this, I don't really know what this is, but I do know what it's trying to portray. It's some kind of deer animal with wings coming across my path. And the point is, without having ever seen this sign before, I have a good idea of what it's trying to portray. And that's visual. Okay. Now what about this one? There's nothing there. But what if you listen? You might hear something.
I'm sure you'll agree there's some truth in what I say.
Right? What is the difference between this verbal communication and those other types of communication? Of course, it's voice. Now you are able to listen to it. You don't have to be looking at it. You don't have to use your sense of sight. This is a completely different type of communication. And now, voice technology is taking advantage of this final category of communication. And so, there are 5 main reasons that I can think of that voice is the reason that voice is going to completely disrupt everything that we do. And conveniently, there's an acronym, VOICE. Versatile. Well, when you think of voice, voice is extremely versatile, meaning you can multitask. You can be driving and using your voice, speaking, or listening to someone's voice. And that's fine. In fact, that's great. But you should not be texting, typing, swiping, or any of that stuff. And so voice lends itself to allowing a person to multitask, a very, very important concept about voice that is different than other types of communication and other types of devices that we've seen in the past. And so voice is versatile. Voice allows us to multitask. We can do almost anything at the same time as speaking and listening. Omnipresent. O is for omnipresent. And just like this picture is showing, when you hear voice, or when you hear sound for that matter, it just envelopes you. Right? It's all around you. You don't have to be looking towards the source of the sound in order to be able to hear it. And so, for that reason, voice, the O stands for omnipresent. Voice is always on and available. It envelopes us with the sound of the spoken word. I is for innate. When babies are born, what is the very first thing that they do? They cry. That is innate. A baby does not have to learn the skills of how to cry. It just cries. Hopefully, assuming everything is healthy with the baby. Whereas any other type of communication, it takes some learning. Speaking, writing, reading, texting, swiping, you name it. Those are all skills that one has to learn, except for using your voice. That is a type of communication that is innate. Voice is instinctual. It is the most natural way that we know how to communicate with each other. C is for contextual. If you get an email and somebody's trying to be sarcastic in it, or somebody's maybe even trying to be mean, or maybe they're trying to be extremely pleasant, but the way it's worded doesn't carry that meaning. It is quite common for somebody to misinterpret some written material because you can't understand the context. Whereas with voice, if I were to say to you, hey, my name's Teri and I'm really excited to be giving you this talk. Or if I were to say, yeah, I hope you're enjoying my talk. Right? The context is so evident in the way that I am saying something. And that is something that is so powerful about voice. So C, voice is expressive. Variations in the way we speak are situational and can reflect emotional or physical states. And this ties into medicine, and we're going to get to that in just a moment. And finally, E, voice is efficient. You can speak approximately 3 to 4 times faster than the average person can type. And if you can do something faster, when time, as far as I'm concerned, is one of our most valuable commodities, that is extremely powerful. And so, voice. E, voice saves us time. It's the most time-effective way that we know how, gotta get out of the way, to articulate our thoughts. And for those reasons, I believe that voice is actually the next operating system. And it is becoming the next operating system as we speak. This is going to change the way that we interact with computers. And that brings me to this. We are experiencing the biggest technological paradigm shift since the internet itself. And this is going to revolutionize the way that we experience healthcare. Now, it's often been said that a really robust healthcare system has these 3 components: the right care at the right time in the right place. And I want to look at each one of these in a little bit of detail to explain why I think that voice could be a solution to our healthcare problems. In the future, we are going to see voice technology in every home. And so we will start with the right care, and we'll keep this in the context of voice in the home. Because when I think of personalized medicine, I think of medicine and healthcare happening in the home. And so let's talk about that. How do you get the right care in your home? Well, one of the issues with the right care is if a person does not have the medical training, and most people do not, how do you know what is the right care? Is it to see your doctor? Is it to take a couple of ibuprofen? Is it to do your physiotherapy? Get out of the way of the notes here. Is it to get a massage? Or is it to climb into bed with a bowl of chicken soup? How does a person know? Well, some jurisdictions try to deal with this issue by having a phone line that you can call into, and you can talk to various healthcare professionals and get answers to your basic questions. Well, what if you could do this instead by talking to your voice assistant, your smart speaker? All of a sudden, your smart speaker becomes the care provider in some restricted manners, of course, but maybe it answers questions that a nurse would answer, or a dietitian, or a pharmacist, or an exercise professional. And in such a way, these voice-first ambient computing devices can become a care provider. What about the right time? Well, again, it sort of goes back to that question. If a person doesn't have medical training, how do they know when is the right time to get care? So if the date is the 9th, and you have a relatively non-acute issue, maybe you could ask the voice assistant about that and say what the issue is, and it would tell you, you know what, for that particular problem, it would be appropriate for you to even wait up to 2 weeks to see your doctor. Or maybe for another problem, it would say to you, you know what, you should be seeing your healthcare provider in about a week. Or maybe it's something really urgent. Maybe it's something that should be dealt with on the same day, not life-threatening, but maybe something like a urinary tract infection, and the voice assistant says, you know what, you should see your doctor today. Or perhaps it's really acute, and you've got crushing chest pain, and the voice assistant can simply call an ambulance for you. What I've just described here is actually a triage system. And so I believe that your voice assistant can start to act as a personal triage nurse in your home. And by doing so, it can assess the urgency of your medical condition. It can also start to now direct the resources of the society, of your community, because it knows what's going on if this information is tapped into a central place. And in such a way, I'll get out of the way here again, it can actually help to allocate the resources for the population as a whole, but at an individual level. Really interesting. So, these devices can start to act as a triage nurse. Another way that this can also help is in the actual office. And this is where the device can start to act like a office assistant. Now, yes, this can happen in the office, but what if this also happened in your home? So that you could talk to the device, and the device is essentially acting as a surrogate for a medical office assistant. And now they can start to schedule appointments, coordinate wait times, schedule things, communicate, and so on. Again, a way that you can get personal health care in your home. Finally, let's talk about the right place here. And the right place, well, again, it's that same kind of question, right? How does a person know where to go? Because there are a number of places that someone could go to get health care services. Maybe it is a hospital. Maybe it's a doctor's office. Maybe it's their community health clinic or a therapist's office. Maybe it's, again, get out of the way, home. So you know what's coming, don't you? What if you could just ask your device? And your device could give you that personal guidance where to go for different problems. Maybe if it's a travel, immunization type question, it would send you to a travel clinic. Maybe if it was something that had to do with your mood, it could send you to a particular therapist, and so on. For that problem, you go here. For that problem, you go there. These devices can become a guide to the healthcare system. So what I've just described, if you could imagine, there are a lot of roles here. There's the physician, there's the dietitian, there's the nurse, there's the pharmacist, there's the therapist, there's the MOA, there's tons. But what if all of these people, all of these roles, could just live in a device like that, a smart speaker? Now we're talking about accessing a healthcare team in your home, personalized to you. So let's talk a little bit about voice first health today and where we're going with this in the future. Some of you may have seen this graphic from VoiceBot. This was done a research study done in partnership with Orbita, and they wanted to find out if people wanted to use these voice assistants in healthcare. And sure enough, already very, very early on in the adoption of these devices, 7.5% had already used these devices for healthcare, and over 50% of people would like to. And in fact, this was done before the coronavirus pandemic, and we know that more and more people are using these devices now for information on this. So I have a feeling that if this study were to be done today, these numbers would actually be significantly higher. Let's talk about some of the common use cases. Aging in place. So we want to keep the aging population in their homes as much as possible. They want that. They want to be independent. And so if they have these devices, as you may know, there are already numerous skills, actions, applications that are essentially voice mediated interactions that can help to connect with family and services, provide daily reminders, even have an opportunity to record things and be able to reminisce about events. All of these services and all these features that can help to keep an aging person live more independently, live more happily, and have a better quality of life. Very, very exciting. Patient-provider communication. Let's talk about this. So, if you have a voice assistant and you can start to communicate with your healthcare provider through it, whether it's to schedule appointments, whether it's to keep them informed of your medical status, whether it's to have a better understanding of where you are with, for example, your diabetes. There are lots of ways that we can use these devices as a conduit to communicate with a provider. How about patient engagement? This is really interesting because this gets back to the idea of these voice assistants being a care provider. There are skills out there, there are applications that are essentially companions to manage illnesses. Diabetes is a great example. So if you have diabetes and you talk to the device and the device monitors how you're doing, it checks your blood sugar, it tells you the types of things that you need to do in order to be proactive with your diabetes management. There's lots that it can do. AI insights. Now, when you take that a step further and the device starts to learn your particular personal pattern, and it can start to detect when something is going off the rails, and it can alert you to that, it can help you get the care that you need before there are significant complications. This is proactive healthcare as far as I'm concerned. And health analytics, imagine that. Now you can start to get data from your own information, and that feeds into the AI insights. The whole thing works as a package. Not only that, assuming privacy concerns have been worked out, and I'm not denying that's a big issue here, but if you can take these health analytics from multiple people, now you're getting individual data, real-time data, and you can start to really do some powerful research when you put this together. Physician notes. This is what I consider to be the holy grail for physicians, and this is being able to control the electronic medical records and being able to dictate into the medical records just through the voice assistants. And then not only that, using AI so that the voice assistant can interact with the physician in a way that makes their practice more efficient and gives them the information that they need. This is more from the physician perspective, but an extremely important part of where we're going with voice technology. And finally, vocal biomarkers. This is a fascinating area to me. And the way I like to describe this is by likening this to a digital photograph. When you take a photograph, in addition to the photo, you capture other data. Things like the camera model, the aperture, the flash, and so on. Things known as metadata. When I speak, there's so much metadata being captured. And here's the example I like to give. When my son comes home from school and I ask him how was school, one day he may say to me, "It was great." And the next day he may say to me, "It was great." Again, it's that contextual part, right? I can hear in his voice the difference in the emotion and what those responses really mean, even though they are the exact same words. And when you can do that and you can tease that out, and we can. Also think about the example if somebody has a sore throat or they're sick, you can hear it in their voice. And if we can hear it, computers can hear it. And there can be algorithms developed so the computer can detect this. And not only that, the computer can be way more sensitive than we can be. So because of that, the computer can actually start to aid in diagnoses based on how we sound, not on what we say. And there's research that's been going on. Some research has found a statistically significant correlation between the way someone speaks and the risk of coronary artery disease. Right now, there is research going on to determine if you can diagnose COVID-19 based on the way someone speaks. And in addition to that, you can also do, and there's research going on basically looking at how someone speaks and the risk of depression, suicide, and also risks of cognitive diseases, Alzheimer's, dementia, etc. A fascinating area. As a physician, I believe that voice is going to become the most important vital sign and least invasive vital sign, because the device can be listening to you from afar. You don't need to go to a doctor's office. You don't need to put a blood pressure cuff on you or a thermometer in your mouth. You can just listen and start to detect diseases in real time. These are just some examples of things that I've been speaking about, and some other ones of ways that I think that voice technology can help with personalized medicine. It can already provide you first aid when you need it. Flu info, we are seeing this with the coronavirus, right? There are tons of applications already out there where people can talk to the application and they get the information they need. Speech pathology, using a voice device to work on voice problems. Prenatal care, that could be any type of care really, but it's using it to answer FAQs, frequently asked questions that people ask all the time. Why not have the voice assistant do that and let the doctors focus on other things that really need their personal attention? Pharmacy questions, smoking cessation, motivational type issues and problems, mental health counseling, post-op care. Doctors, surgeons are sending people home with devices so that the devices can walk them through their post-op care. nutritional counseling, and then the one I already spoke about, I'll get out of the way here, chronic disease management, like diabetes. So I want to finish off with 2 last points here. You know, in the past, it's often been said that healthcare is patient-centered. And it's a really nice concept that the patient's in the center of their healthcare. This is how I view patient-centered health. There's the patient. The patient is clearly in the center of a maze, a logistical nightmare. It's so hard for that patient to navigate the system. There's just a maze of moving pieces. And what gets me really excited about voice technology is I believe that in this world that's becoming voice first, we are actually entering a world that's also becoming patient first when it comes to healthcare. Meaning the patient is at the front. The patient is at home. Personalized healthcare. They are able to interact with their device. And that is the beginning of the healthcare journey. And of course, if they need the support of other healthcare providers, there they are, right behind them, helping them, supporting them when they need them. But I think this model is the way that we're going to. And when you take these devices and you put them in the home, like you've got now in that upstairs window, what happens to that house, that home, is it becomes a medical clinic, a mini medical clinic. And when you start to put that into multiple homes in your community, you have a row of mini individualized, personalized, decentralized clinics that are going to allow us to really, really practice personalized healthcare. And so, in conclusion, I want to thank you for that, and I want you to think back to that video I showed you, where that sick bay and that mother bringing her child in, and that's happening in the home. And I believe that voice is the beginning of that type of thing that we are experiencing. And when we wake up in the morning and we feel that sore throat, that cough, and we're worried about having to bundle up and go to the doctor, instead, you'll have a conversation with your voice assistant. And the voice assistant will say to you, "Hey, I hear that you're not feeling so well and you have a cough. Can I help?" And you say yes. And that voice assistant talks you through, asks you questions about what's going on, and it gives you advice. And maybe it sends off for prescription and is delivered to you by a drone. The point is, it's personalized. It's happening in the home. And you don't have to leave your bed. Really, really powerful and really, really exciting for the future. And so I believe that voice technology is the future of healthcare. And I encourage you to join the discussion, reach out to me. I'd be happy to hear from any of you. It's a very, very exciting time. And I want to thank you for your attention. It's been an absolute pleasure speaking with you. And I look forward as we move forward together in this world to bring the personalized healthcare home. Thank you very, very much.